Canada's premiers were grim-faced and disappointed today when they left a critical meeting on healthcare.
They met with Prime Minister Justin Trudeau in Ottawa to discuss the future of Canada's healthcare system and came away with much less than they were hoping for. Al Sweeney is covering the story and joins us live in studio with the details. Al.
Hi there, Taz. Well, one point the premiers and the leaders of the Northern Territories make is that the whole issue of healthcare funding is very complicated, and they're going to need days to figure out the funding offer made by Ottawa today. But on the face of it, they say it's not nearly enough. After a meeting that took about 3 hours, not as long as expected, the premiers were dejected when they talked to reporters. Manitoba Premier Heather Stephenson spoke for them.
There wasn't a lot in the way of new funding that is a part of this package that has been put together by the federal government. And so, I think to say the least, I think we were a little disappointed at that.
It's a real pleasure to gather with all First Ministers across this country to talk about health care.
The premiers were asking the federal government to put about $28 billion a year more into health care, so the federal government would pay 35% of the cost. They say the federal offer is nowhere near that.
$28 billion, of course, was an injection that we were looking at in the first year to get us up to the 35% on the part of the federal government. And what we see from this is it's actually less than $5 billion, I think around $4.6 billion.
In French, Quebec Premier François Legault was blunt. The federal offer does not solve the fundamental problem of funding health care in Canada, and there will continue to be a problem. Ontario doctors were also hoping for money to solve the crisis in health care.
We need a long-term, stable funding formula for healthcare in Ontario. We know that right across the country, patients don't have a family doctor. 5 million Canadians don't, well over 1.5 million Ontarians don't, as well as wait times are far too long.
Premier Doug Ford called the federal offer today a starting point, but sees difficulties.
It's a down payment on further discussions, home care. Who's going to take care of the costs of the escalation of PSW salaries and other costs that increase? So we'll sit down. This is the beginning. I always look at it, glasses half full.
Ford was also asked if the Prime Minister did anything to stop any move to privatized health care. Apparently not.
No, that conversation never came up.
He said he's still looking at ways to transform the system. The NDP is worried about privatization.
We want to make sure that there is no funneling of public dollars, the funds or the staff for that matter, to for-profit facilities. It should be a condition. And we want our healthcare to be expanded, to move to more public delivery, not further away from it.
The premiers now say they're going to meet again soon to figure out how to respond to the federal offer. So we were expecting a statement from the Prime Minister late this afternoon to give his side of the story. We haven't heard from him yet. As for the premiers, the best thing they could find to say about today's meeting was that it's a starting point. Quebec's premier was asked if he actually cursed when he was given the federal offer. He said only that he tries not to swear.